but I don't came up that way. So they should be able to. They should be able to. They have a computer that still has audio on it. When you hear it. There's
Matrix.
So you guys will want to turn your audio off on your computer, otherwise you get feedback between the two things. I'm just hearing it just a little bit.
Yeah. Good.
Sorry.
Thought, no.
Hello, 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 hello. Just turn your speaker off. They were requesting.
So now we should-
Yeah, should be good.
And this can sit by you if you want it to, or it can sit up here out of the way.
I might take it back with me.
Perfect. Yep. Sorry, it's not really attached. It's just an option.
Just in case.
Love the acronym. What's that stand for?
Youth, adolescents, and children.
Yak.
I don't know if Alexander came up with that or who came up with that.
How we came up with it.
Before I got to participate.
No problem.
Well, and because we had no on the other side until this morning, it is a little muggy. Plus it's set on a higher temp automatically, which I don't know.
You just, if you want to know. Remote for the camera.
Yeah, I stuck it back over there on that stand.
We tell the leaders that. No.
Okay.
So these
So
are
we
the
could
numbers I was.
actually-
You want to tell the leaders that they're supposed to sit up there?
What?
Do you want to tell the leaders that they're supposed to sit up there?
Is that where you want them to sit?
Probably if they were up there.
No.
Since they're supposed to be leading.
No,
Prefer if they sat up there?
There's already presets in there that I set.
Nice. So he was mentioning that if you wanted, if someone was going to be talking from the front, like actually presenting, we could set you up with a couple of presets. So one would be this whole room and the other one would be zoom in on the front area.
I would actually.
And then you could bounce back and forth if we can get it to work.
Potentially.
Uh-huh.
This is part of our learning curve at this point, is to get all of that to
In theory.
work well.
Oh, it did. It did. zoom in. That one. Zoom out.
So that's really as close as we get anyway, huh?
I'm gonna go like this, just so.
Fairly.
That seems far, but I don't remember how much more zoom I've got there. That's perfect for the whole room.
Go down just a smidge.
Yeah, that'd be great. Perfect. See, I was afraid to mess with too much more once I got it to come out a little ways.
So I'm gonna give you the sign-in sheet to pass around to people. That's fine.
Or do we want to put this sign-in sheet?
I just
here?
feel like it's here.
Yeah, I might set it here and then I'll see who does and doesn't, and then,
Why?
and that way I can be like. If you didn't get a chance to sign in sheet, I'm gonna pass that on.
So one. It's remote, just doesn't. Wonder if it needs new
Terribly
batteries.
responsive, is it? What's it need?
Triple A's.
I don't know if I have any back here. I have some up front.
I know.
Yeah, I'll look in front and see if I have some triple A's up there. I need to put some more double A's for the microphones too.
Standing in the right place.
Yeah. Do you just want me to scroll down as? Should we call? Like, do you want me to call and check on the food? Open.
Find out.
Well, hello, Vincent. How are you?
Good, how are you? Good. The food is supposed to go there, right?
Yeah, I think.
I
we
put
can
it,
bring in.
oh, sorry.
No, that's fine. You're just fine. You're good. We were, both of us were sitting here like, I hope that there was gonna get something. I don't remember where we should.
I got somebody's phone on the top of that bag. I'm listening to. Only worked, huh?
Sort of.
There's a couple AAAs too.
See if that
My
helps.
package, I don't know if that'll make a difference.
What do you want?
I sometimes those they they aren't super great.
And I didn't have a facilitator's agenda.
I think it was. But,
I don't know if you have maybe the wrong email, because I kept checking the last email I have from you.
How are you?
Good. Can you please resend it? Otherwise I won't have access to it.
No, for sure. Do you have, what, well, I was gonna.
I think they asked for seating. I don't.
You don't have any printed out?
No, not of the facilitators. For the agenda.
That helped out.
Okay.
pretty-
It made a world of difference. Okay, good.
Sandra.
So let's. That would run the camera angles. Would you rather do it or you
One and two.
So it'll
One
change
is
it.
zoomed in and two is like the.
Just pointed at the camera, back camera here. So it changes. The 1 and 2. You want to push 1 and 2 up here on the top.
Oh,
No, it's actually these.
Oh, it is those. Okay.
How's it going, Jack?
The one is these, like,
Are we not close enough? Is that still what it is? That distance thing?
I could maybe, we could also have Alex.
Maybe we just want to leave it out. It doesn't seem to be too cooperative.
Oh,
Oh, there it finally is. Yeah.
there we go.
So it just has to have the right angle and
Right.
everything, but
Finesse.
if you want to it, yes. That's available.
Yeah, that would be an option. You could zoom in anyway if you wanted to. So
Don't hate me. We set up, we were gonna ask the leadership team to sit up front. Do you guys hate that idea? and you want to rebel against it, I would support that too. But
Or
I'd rather be at table so we can get.
Oh, I see. Sorry.
I feel like it's, that suggests that.
I think that was the button I was trying to push first, so that was my confusion.
Well,
I just think sure of the way if we're leading conversations, they can lead.
here's what I wanted you to do.
I will, I'll tell
No, you
Dulce.
never know.
Yeah, no, for sure.
It's real.
Hey, how are you?
good.
Camera one.
Which one? We haven't sent it yet. And it's funny because, yeah, this will.
1, 2,
They told me just a longer interview for, trying to put that everything we could for somewhere. Okay. Engaged.
Congratulations. Sabrina did the ones back. I've done that.
Asked her if you would came, assistant teachers, because they're. So I was like, okay.
So sorry, because I must have. I
extension
like moving and switch job.
Onto the house phones.
Busy and
It's a lot.
Me too.
one day at a time. Yeah, that's what I've been trying to do. Safe space. See, we'll see.
Does it, that one just reflects like.
Here.
Hi. Okay.
Try to stay away from that at first. And
Like that for the fire. Sorry, I don't know why.
that opportunity to go.
Martha even had me with me.
I went back.
I was just forwarding the facilitator's agenda to her and. They should all. I guess I can get off the chips. They should have chips. Cookie.
And then there was an email companion. It said HA. That was from you. I think Lisa was asking me about it. I looked for the email. That was the last one I found. And it said HA. I went there and I saw. I was like, no, it's that's what I thought it was. I remember that was the email says HAC.
I'm really sorry. I'll have to look at that again. I did not mean to confuse you so
No,
badly.
it's okay.
Well, Ellery, there was two calendar invites and
Yes.
Oh,
that's what I'm
HAC.
saying.
we updated the location and yeah, they're still.
Perfect. So there should be 9 of
That
them.
makes sense then. For Wi-Fi, it's
An hour.
And Lisa is like. She is. Her niece is
Giving you like
the summer.
$100 if I could find something that would be close to that. Like if I said $60 an hour. Yeah. And then I paid that separately. Total.
I got vegetarian, I got like.
What? I think, no.
and I can just say if anybody.
Tammy wants. Tammy wants me to send her, and I'm gonna send it. to her. I'm gonna send her the budget no matter what, and just say I'm waiting on. Costs that are associated with the sign are costs.
Check sandwiches.
Where you at?
Get your information about this.
And it's 9 and we were 13. It was just
Had an email from.
not, yeah.
Oh, yes, I'm headed there.
For the
Feel free to grab a bottle.
diversion program.
Thanks, right?
It's just reaching out because he was trying to talk about your program to someone, but I can't remember what he said.
Right. Anybody here? Hi, Haley. Hey, how are you guys doing?
Anyway, I was like,
How is
it?
Because we already do that.
Megan, is like.
So I was gonna ask you.
I did been on semi-permanent vacation.
I was trying. Not good.
Yeah, yep.
Oh, I lost my number. Sure what.
It's okay.
Show you. It was a blessing. Really nice, probably was.
I misunderstood him.
So I emailed this.
Move it, Toots.
Oh, man.
She knows my name.
Oh, man.
Yeah.
Now that it's been this long, I think they eliminated the position. In my position, we're let go too.
Okay. I said, that's yeah.
I'm definitely.
Yeah. Yeah.
Yes. It's really hard to find something.
Good, how are you?
Training.
And they did.
Yeah.
I almost was a compliment.
Yeah, I was like, I had to leave early and I was like,
And then after all, we're like,
it's actually, it is, you can, I'm like, send the reminder out to the group.
I don't know, I'm going to until about 5 minutes before, and I'm like, okay.
Wait, where am I going?
okay, so I get on. So then it was that night I got my number. Mentioned response.
Gail?
Your friends outside. So anyway, got on the call, HR was on the call. Right? That should be changing your status.
Sorry, Emma.
Yeah. So, I don't care. It's. No. Told Leslie in disguise, my boyfriend about a state 2 days before I lost my job. And he proposed now I'm moving, and he was all promised. Getting a job. Yeah, doing all the things that was
Everything.
yeah. No hard feelings about UPS. I hope that they're gonna hire the
Little stretch.
And I think I can boost that number a little bit.
Oh, yes, I'm going to.
I'm on there.
You did. I know what it is.
Yeah.
Wherever.
Oh, there is a number.
Signing.
She said.
Sure.
Not sure what's going on.
Okay. So. I sent you something.
Then something. I was thinking it was just the release.
Yes. I don't know that it was in for information.
Is it because?
I wanted.
Or do they want that one? Yeah, choose for the tonight.
After I sit down and I see you guys over there, I'm kind of excited about that break.
I was like, I could see you. I won't feel offended if you want to go.
So I was just.
Okay.
All right.
And they changed.
We're all with school, but it's okay. to-
I've been moving for a while.
Reach out, right? Yeah. What did I think I did when we were at the? We sat by.
That's really, that's really. So that was my, I knew you had talked about that. Talked about the, I don't know what it's. Way. Connected to this. On this.
Your phone and your badge? You got yours? Yes.
And I was willing to do it.
How you did.
Really? Oh, that's easy.
Okay. Already lost.
Do you want me to call it? So you can hear it?
You would like to, I hope.
We have an infographic that we've had for.
Volume was on.
Wait, are you calling her? I'll call you at one.
It's beautiful. He said, ask me that. I'm like, access from like, you know. Shauna.
Do you know why I put this up?
Interrupt.
Let's see. The wrong
I better grab some lunch.
On that note,
I mean-
everyone's leaving.
Oh, man. I found it terrible. It wasn't uncomfortable before. It is now.
Just pray to God. Right. I usually do. I'll probably be here about 5:30. Mine was, I don't even remember where I'm at. See, okay.
I know.
You and Shannon are both.
She was just saying that she's here tonight too.
It's going.
But I do want to try to get something for August. Really well. Good. Last, I know it was recent for 2 weeks ago. Yeah.
I didn't get it.
Let me grab my calendar. And we were like, do it anymore. I get that.
Some other.
Your son is eating.
Not.
No.
Yeah, I was just thinking. Well, that's the best.
How about you? Did you get one there?
It's very exciting. No, a couple weeks ago, so my way that you're here. Seriously, do a nice.
One of my friends from.
So you're just gonna zoom in from Washington.
I don't even know what I'm gonna do. I don't know. So, thank you. Yeah, we talked about like sometime in September. Absolutely. You here already?
Why not?
Just flying by the seat of my pants these days. No, I don't. I just was thinking if you were here already, I didn't want to make you come in at night.
I don't really know any part of
It's
Washington.
it's like 3 hours from Seattle.
Okay, so we have a former intern. Job in the field. I can't remember exactly. And I'm just wondering if like, even if she's anywhere. She's very outgoing.
Thank you everyone so much for being here. Thank you for joining us today. I know these first people settling in, but we are gonna go ahead and get started. I'm going to turn it over to Dulce. If you had any troubles to accessing the agenda or emails, I know that there were a few people that had some email switched and stuff, so just let Alex and myself know. I'm going to be passing around the sign-in sheet, so as that goes around, just check that you have your information correct on there so that we get you your information correctly on time. But I'm going to go ahead and turn it over to Dulce for introduction.
Welcome again, everybody for joining us today. Let me know if you can hear me. I tend to speak very softly. So interrupt me at any time. I'm aware of that. So welcome again. We're just gonna review for now the meeting purpose quickly. One is to reflect our collective knowledge from our last meeting, share resources and learn about parents and the community through feedback from members. All right, right now, we would like to just start maybe with this table and just go around the room clockwise, with introductions and with which agencies you're with right now.
I'm Lorraine Flood and I'm with the Early Development Network, housed out at ESU 10 here.
I'm a human private consultant.
Anna Miller, Behavioral Health Coordinator at Community Partners.
Alexandra Dillon, Early Learning Connection Coordinator based out of ESU 10.
Candy Koenig with the Monroe Meyer Institute located at Children's Physicians.
Sarah Piter, Director of Preschool and Elementary Education for Kearney Public Schools.
I'm Shannon Foz. I own the White House Academy Child Development Center.
Erin Small, Sixpence Child Care Partnership Coach with Kearney Public Schools. Libby Harsh, I'm also a Sixpence Child Care Partnership Coach with Kearney Public Schools.
Penny Parker, Nebraska Full Care Community Outreach.
I'm with the Buffalo County Attorney's Office.
Deb Schroeder, I'm a board member with Buffalo County Community Partners.
I'm Ellery Butterfield, and I was distracted for a moment, but I'm with Buffalo County Community Partners. I'll go last.
Lieutenant.
Cochran, Hot Meals USA.
I'm Hope at the Safe Center. Laura Yamba with the University of Nebraska Medical School.
Hinkle, the Family Nurse Navigator with Braddock Sub, who will be presenting later. I also work at Children's Physicians.
Michelle Lauren, and I'm with UNK Spanish faculty, but I also represent the UNMC Radix sub grant that we're going to be talking about a little bit later with migrant education.
Giselle Amar, Community Coordinator for here a little bit.
Wheeler visiting. Kathy Gifford invited me to come. Part of a group called that Prince of Peace, and she thought this would be.
Educator.
Fran Patterson, Nutrition and Mental Health Coordinator for Community Action Head Start.
Wanda Fedorchik with Buffalo County Community.
Space, the Community Outreach Coordinator with the Corresponder Program with Youth and Family Services, Kearney Police Department, and Buffalo County Sheriff's Office. And we do have
I think they'll stay on.
Okay. Yes, is that it?
And Jessica Vickers is with Live Well. Is that correct?
Yes, yes. Live Well County. Johnson.
Angie Johnson, owner of Adventures with Success Child Development.
Adolescent. Program in the 20th century. I'm a multi-systemic therapist right now. I also open up which is in translation for businesses, agencies, and individuals as well. Our agenda would be in April. We did not have a meeting in any April 26, 2023.
Does anybody know if they didn't get a copy of April's minutes?
Just a reminder to write your on cardboard as well. And I guess I just want to reminder the purpose of the parent engagement partners today is to dive into the fact about how to support parents in their community. The group talked about the program like CASA levels, also provide opportunity to build connections between engagement partners and work with members. In these laminated pages, we have our well-being collaborative. It's an overview of collective impact. We do have orientation for new members every third Wednesday of the month. It's an opportunity to be on our progress so far. We have been involved with us for a while. That would be the next thing on our agenda would be for Radix.
Thanks, Dulce. I just wanted to thank the Radix Up team for providing and sponsoring our lunch today. They provided water, so thank you guys. We're going to give the floor to the Radix Up team to present their community report. Populations and research projects that are studying COVID across the U.S. So their study is unique
So much for letting us have precious time at your meeting. I'm Michelle Warren, and I was able to get to know a lot of you during the pandemic. Some of you I've seen more on Zoom, like Penny and Haley. You know, I look around the room and I'm like, oh, what's that person that I've been meeting on Zoom? But we're really glad to be with you and to have your support in the community as well. We represent a group that is actually met because of Martha and Denise in their first. We work with a team of doctors and we are recipients of the National Institute of Health grant called RADx. And the main target is preventative health care for underserved populations. Our particular work is directly with COVID and COVID testing, so it's diagnosis, right? These guys are the boots on the ground that know a lot more about the actual day-to-day part of our leaders project is not. So we have almost how many people total?
So today we have 80 families.
Yeah. So all of these people report their health symptoms at least twice a week on an app, a digital app. And if they are prompted to do so, they test for COVID and they are able this way to hopefully so so we don't just worry about COVID and there's no economic implications. Without further ado, I'm going to turn it over to this team now that you can use your voice again. Please have a sandwich if you didn't. You ordered for
Give
45.
Giselle Marcolino, community coordinator for athletic section.
My name is Laura Gamboa. And I also the community navigation. I work for Raxa Family.
And as a family nurse navigator, I am the one that actually uses filling out their app, and then if they have questions or not affording enough food, skipping food, not being able to afford healthy food, unsafe neighborhoods, any other ones, childcare. There's a list of them, and so those are the ones that I've been following up. And one thing that we wanted to share too is that it's statewide. We have a lot of communities.
So families are encouraged, they're enrolled, they're given COVID testing for everybody. And then they're giving the M-Health tool, which is an app that they have on the phone. The app has two components. The first one is decision making and support. So the app's not gonna probably do anything. So it's like there's somebody in my house, maybe a 5-year-old, 10-year-old that's had COVID. And I put symptoms on the app and that's gonna try. And then that's when I make the decision that, yes, I do want to test, or no, I don't want to. There's other things added to it, but that's kind of like the main thing. The second piece of it is the socioeconomic part, which they do have a list of challenges in the household. If there's no challenges, again, they're done. If there is a challenge, then they're asked if they want the resources, additional resources, and that's where Sarah comes in and kind of follows up with whatever balance they might have with the household.
So the mobile health, the migrant health, and health for M-Health is to empower migrant families to make optimal choices for their COVID-19 and to maximize in-person school attendance for children from migrant families. M-Health for M-Health partners with migrant families, the Title I advanced higher education program, and help families to connect families to high quality COVID-19 testing and decision support, as well as linkage to community resources. M-Health for M-Health is funded by the National Institutes of Health, Rapid Acceleration of Diagnostics and Program. We are focused on the Title I migrant education program. We live primarily in Central Nebraska. And these are two of our partners, and it is the Central District Health Department and it's the Two Rivers Public Health Department, along with the migrant education program.
Then I'm gonna go over some of the app. It's the main key component. There's different factors added to it. One of them is reminders. We're in constant communication with families. So we send out reminders twice a week because they fill out their and by them filling out their questionnaires, they get a compensation. They get $40 per person, per participant every month. So if you have a family of 10, each participant is getting $40 in gift cards every month. So there's that kind of communication there. Allows families to let us know if they saw this is a prior, if they got something going on that week, they'll let me know so then I can get back to Jared. So there's that flow, that communication every week. We also have the component of qualitative interviews. Not everybody done qualitative interviews. We ask the families if they want to participate, and if they say yes, because everything's moving fairly, if they say yes, then we go ahead and do an interview. These interviews they have questions regarding the from 2019. We ask questions like
keep distance at the workplace. Just like that. Expected. Here, that's it. Side to it, there's families that sometimes then. And they're just sharing, what they're going through. They might have issues with their kids at school. They might have other things going on in the house, and they just want somebody to hear them and somebody to talk to. Some of our families are here by themselves, so they don't really have a family support, a mom, a sister, they're by themselves. And that's something that surprised us a lot to spend, and obviously we're more than glad to spend those 45 minutes on the phone with them. But once you hang up that phone, you realize, that you just help somebody back. Maybe for us, it's 20 minutes and we had something else going on, but for them, it meant a lot. Because after those 45 minutes, they vent, so they pull back. We also encounter there's families that have shared how they've been in the US for the state of Nebraska, for 7-10 years. And in those 7-10 years, they have not seen a medical provider. Maybe insurance, maybe Social Security. There's multiple reasons. But if you start thinking about it, families that have not seen a doctor for 7-10 years, that's a long time. We go over a survey and we ask them, medical questions. Do you have diabetes? Do you have high cholesterol? And some families, all the questions they say, I don't know, because I have not seen a physician 7-10 years. So that's a lot. That's something that we share with Dr. McCullough, and we're trying to figure out if there's anything that we can do about that. So again, it's still that work in progress that we're trying to figure out what else we can do for the community. There's some of the families that have shared that during COVID, they tested positive, but he's at home, really sick, and all they could do was home remedies. I'm curious. I wanted to ask him what those home remedies were. I couldn't. That wasn't a question. When you do gives you a different picture and the community, especially in their micro community. And also share how grateful they are for Jara, for a family navigator. It's gotten to the point where some families, they call you directly when they have something going on. They don't have to use the app. They have also shared how they feel empowered. And so when listening to their stories, they're going through. We'll also share how the gift cards help them along. So if they don't get their gift cards by the time we say they're going out, we should be getting a couple of phone calls and text messages asking when they're going to get their gift cards. And then again, we have heard some feedback from agencies and how grateful they are that here, and we are also so grateful, especially for Martha Haley, that you guys have been helping with us. We couldn't have been able to do anything without you guys. And I'm going to hand it up to Tara.
Well, as the family nurse navigator, I think you're aware that I follow up on a lot of those household challenges. So this can fill those out as often or if they want. However, the conference that I've got over for me, so there's been over 160 household challenges. And I find that really interesting. Made connection with me. We have 8 families total and had 27 reach out for help. I find that interesting. Of the 27, there's only been 2 that speak English. So I use the interpreter. We do at through children's physicians, we use the Seracom Spanish interpreter. So we do get used to that. Sometimes Gisela is able to help me with those patients. And I have been in the community for quite some time and I've made a lot of home visits. But I will tell you, this has been a very interesting piece of my career. Because it is just a little bit different. You have to listen a lot harder and ask a lot of questions. I also wanted to say out of 27 of those families, only 5 of them were outside the central Nebraska area. So it's been interesting to me which communities maybe have people that have identified more than other communities. A lot of the one thing that's been interesting is families feeling unsafe in their neighborhoods. And I would have never guessed that there are families that did not know how to or to even call 911 if they felt unsafe in a situation. So those are maybe some of the basics that we don't think about. I think about some of the food. Food was second highest on the list besides lost income. You know what? We have a lot of food sources here, but it's just understanding where it is and the confidence around it. And if there is anybody involved in those projects in the community, you can buy local signage with them. Let them know that they're welcome. Gosh, some of the churches even do hot meals and families weren't aware that it was someplace that they could actually go with their family and sit down and eat. Which of course brought up transportation. And the good thing is I have been in this community long enough that I know that there's lots of good things going on and good things are going to continue to go on. Child care was the big thing. You know, Spanish providers. Penny, I wanted to kind of give your kudos as well. The the Medicaid programs that are in Nebraska, a lot of them have rewards programs. When you think about a family coming here, if you came to another country without anything to start with, what's going to be helpful? It's our gift cards that are going to help. Sometimes there's at least one child in the family that has Medicaid that they can look at resources to Medicaid programs. It just kind of really puts a different perspective on home visits. And just to let you know too, the families that are in the migrant program, children, 5. And did you want to mention how many, it was mostly what, 6th and 7th graders?
So we're gonna start with the dad, and then that's. So then this was the data we put up last month, like you said, is that we have a lot more. So you can see the children back then. So we have 290 members in the household. 155 of those are children. Then 25. Thank you. 25. Or yeah, I believe it's 25 are head of household, and then the other are just. For example, would be like the parent or the husband or the grandma, whoever else lives in that household with them. So just that's the average age for the kids are basically 11 years old, and then for the adults are 38. Please scroll a little bit down. Too far? Yes, that's fine. So
Also, sorry, not to interrupt, but if anybody is having trouble seeing on the screen, we do have physical copies on the tables and we have more if anyone.
So for the stuff, we are just doing like Sarah said, the migrant program. But for our program, I believe we just go up to high school.
After 19,
present them as adults.
They're still involved in the program as long as they have someone still in the migrant education program. The highest age we have is 6th graders, or they're basically the middle school age of the children enrolled in our study. So we have from kindergarten to 12th grade. The highest ethnicity we have are Hispanic, Latino, or Spanish origin. Some choose not to answer, and prefer not to answer, and some are not. That's something we've come across where, if you go to the next chart, we've come across where not all individuals or families in the migrant education program are Hispanic. We have some that are Somali, we have some from other places in the country. To be in the migrant education program, you just have to have been moved here within the past 3 years and have like agriculture background. So it's a whole wide range of backgrounds we have. In our study, at the moment, we're only able to serve Spanish-speaking families. We're trying to recruit or have more available resources to have those families be able to. At the moment, we just have Hispanic. And race of people just choose that no answer or white. Another fun stat is we have 95 males and 109 females. Next one, please. So these are all the school districts that we have currently enrolled. To make it easier for you guys, we can just go to the map on the next one. These are basically where all the school districts are. The darker the color, the higher participants we have there. We are recruiting across Nebraska, and we meet these families through the Health and Higher Education program, going to conferences, events they have, and then we're able to recruit these families and communicate with them.
Something really interesting about this map is at the very beginning, Michelle and Martha, I think both of you were involved at the very beginning. But it was only said when I joined the group, it was only supposed to be Kearney and the only 2 places we were gonna recruit families. And then once we started, we kind of seen a little interest from, families from different parts of the state. So then we decided to have it be statewide. We have families from all over Eastern Nebraska. We're still recruiting. We'll continue to recruit probably until November. And Michelle, I don't know if you want to close.
Advantage of the moment to take pictures of you in action. So you can see that the work that we're doing, and particularly that these ladies and also Fernando Sanchez, who is with us, are doing a lot more to do with the work that you folks all do in your jobs. So you do a lot of outreach and try to help connect people with the services that they need, which is why I think Buffalo County Community Partners ended up being such a tight fit with what the grant had to do with when Rusty first came to them. We are actually ending this grant. We have 1 more fiscal year of this grant, but we are applying for further monies so that it's actually another type of grant through the National Institute of Health, so that it's still under the auspices of COVID detection, testing, and early detection, but as you can see, this does a whole lot more than just test for COVID, right? So we're looking for community support. We want to come to people like you to say, what can we do that's helpful with the clients that you're serving? What needs do you think that we can also help reach through the program that we're doing? And we're hoping that we can count on your support too, with a letter of, I think I asked you, Martha, the other day, a letter of support for the grant application, so that they can see in Washington that we're not just kind of shooting in the dark. We're actually working with the vested partners that can see that we're doing something. We're not just researching and mining our clients for information. So, any questions?
Guys, do you work with Proteus currently?
Proteus is one of the contacts that I've connected families up with as well. It's amazing the different resources that we've come up with. And we're starting to get a pretty nice list from across the state. Now, if anybody is familiar with any that are specific to migrants, please let me know. We're always looking.
You said it's,
Probably been one of the most helpful is one called MyLink. And I don't know if anybody's got that on their phones already, but when you're working and communicating with families, you can have yours on English and they can have theirs on Spanish or Somali.
Vietnamese,
As you're looking up
Arabic.
for resources. So, I'm sorry, Emily.
there's a migrant family task force out of Omaha. Is that something you guys are part of as well?
Well, we work with the State Department, the State Department of Education and the Migrant Education Director who's with them. And so I actually was working with Matt Blomstead, who was the Commissioner of Education. I think he's stepped down now, but we did work with all of the official entities.
I'm just wondering if that would be a good place to present, like on one of their calls to like target that audience. Because all the organizations on there work with like refugees, immigrants, migrant population.
And Emily, I am familiar with that because of Children's Hospital.
Right, okay.
We've had some trainings on that, but yes, I'd like to grab your contact.
Would be more than that.
Well, and any of your organizations also that meet and that serve migrant families who have kiddos in the migrant education program, we'd be happy to, bring one or two people to one of your meetings or come in on one of your Zoom meetings to talk about it if you think you have clients that you think might identify and want to be included in the study. The benefits are nice. I mean, they have, a little extra help to access services, and they also do get the gift cards. $40 per person, right? So I mean, if you have a large family, that actually ends up helping with groceries and things like that.
And they can use their other Visa gift cards, so they can use them anyway.
I was gonna say, just for years,
Yeah.
We have other schedules to go to.
Yeah, I think we're working on trying to get with JBS in Grand Island. And
Because some of them are gonna be like former migrant families, so they're not turning migrants.
That's great. I'll say that's a.
This. And like I said, we're still enrolling, probably till November, so.
And hopefully this work will continue. It's like any, you all know, when you're at it, you might be was working up until the last date that grant funds you for another funding opportunity. That's what we're doing now. So cross your fingers for us. Other questions?
I think we're reaching 10 extra minutes. So sorry, apologize for that.
We all are very passionate about what we're doing, so we all talk too much, but
We do. We always say that we're gonna keep it short and sweet, but. Well, thank you so much. Thank you.
Before Penny gets started, I was just going to announce that it is hard to hear on Zoom because the speakers are in the ceilings. So if anybody wants to take a quick, like 30-second rustle your papers or throw things away, I think maybe we should do that now. And then it's a little bit easier for them to hear right now. Michelle has the heart emoji. Michelle, sorry.
Hi, Michelle. Michelle.
Guys are doing that. Dulce does have clarity cards here for translation interpretation. So I'll pass those around now. Thank you.
Michelle.
Okay, hop in the medical.
Oh my gosh.
But he knows like all kinds of languages.
He does?
Yeah.
How does he know so many languages?
Like has this dog drive.
Mess.
She has like the 3 different ones now. She's a counselor. She does.
Not at your parents, not at you, but you could, they have medical constellation classes, and that's how you do the transfer specifically for clients.
Okay.
I'm not siblings or children. I feel fascinating for the parents when they're.
You guys ready?
I think so.
Okay, guys, I think we're gonna hop on to the next part of our agenda. It's to refresh our lens on our goals. So, okay, it's up here. Just a quick reminder of what our goal is as a group, building relationships with existing parent groups in the community. So short-term, what that looks like is building relationships with existing parent groups in the community to learn where parents are accessing resources. And long-term, we want to parents to know access points in the community that are easy to understand and accessible based on education, training, programs, and services. We talked about a parent engagement center where parents can advocate for each other, support each other, and that it's peer-led. At this section of the agenda, we wanted to have any parent engagement partners that were present or invited today to answer some questions for us and kind of just discuss some things by show of hands. Are any of you people who were invited as part of a parent engagement partner today?
Person I invited had to leave.
I think, yeah, we lost a couple, and that's fine. So as a group, we probably want to discuss, we do have the parent sharing an Excel file, but as a group, we probably want to discuss how are those conversations going, inviting these organizations or these folks to the table, and what can we do differently to make sure they can get here and be part of these discussions. So I guess I'll just start with that. Anybody have ideas?
I know that the parent engagement partner I invited, she runs a daycare here in Kearney and works with, I mean, anywhere between, I think it's like 6 to 10 kids a week. But currently a couple of her barriers have just been childcare. And then also, you know, she was like, I could join on the Zoom option, but it's just a listen in option. And I think there's still, even with the rustling of papers and stuff, I just don't know I don't know how to make Zoom a better option or more accessible if we wanted to have parent engagement partners. But those were a few of the gaps that she shared with me, is that somebody to help run the daycare for that hour that she would be here, and or a way for her to join virtually so she wouldn't have to leave the daycare.
Great feedback. Thanks, Ellery.
I was supposed to invite a couple of my family service assistants from my agency, and the biggest thing that we ran into was, granted, right now it's kind of a wonky time because about 3/4 of our centers are out for summer break. But the other half of it is that this time at 12:30, there's still kids. So they can't leave the centers in order to come be part of this until after a little bit later in the day. So I think scheduling is kind of a big thing.
Sure.
Can I ask a follow-up, like what is a good time then for those?
Our full day centers get out around 3:30.
So anytime after 4, probably.
Great feedback. Thank you.
I met Lisa, who works with the migrant program as a service provider. She does the home visits for them. She was named with me today because she had to stay at the summer school program and supervise that right now. And hopefully she can join us in a future meeting, but it was a very last minute change for her.
What are our thoughts on, like, in an August or September situation, moving the meeting to a later time frame to accommodate maybe some of these folks? Like if we did a big question with people. September a better time than August with back to school? What are your thoughts on that? Don't do the end of summer craziness.
I think even if it's at a time where people are still in work, it's easier for people to like leave an hour early from work than it is to take 2 hours off in the middle of the day.
I think with those stipends for like if, you know, I think, you know, we also work trying like an evening type of like a not as formal, you know, that they don't have to stay for the whole thing. Maybe it's just kind of like a social kind of event so you can get their feedback and their input without having 2 hours of a meeting.
Yeah.
Like just like that meeting or that, I guess, event just to be just for them, yeah, for that purpose only.
Or maybe if you hit that 4 o'clock time, childcares are still open. After school programs are still open. If you can get parents here at 4.
We were gonna do like a dinner or
I
something.
think what we wanted for today was parent organizations. So organizations that are serving parents that can tell us some of the questions that we had planned to ask. What resources are you using that are most valuable? What do you see, like, what are your parents, what are they experiencing here? So these are hopefully our organizations that are good at what they do and already serving parents and help us collect more of this information to provide to parents. Obviously, some of them will be parents, but yeah. We just need to hit some of those that are taking care of children. Yes, why we're struggling. Okay, well, I don't really have a whole lot more on this section.
I have another question, Penny.
Anna or Ellery?
Yeah, so do we, because we have had this conversation before, like when you kind of come to this point and you're like, oh no, this didn't work. Are we still in line with the goals that we feel like we want to achieve? So I was looking at, and Penny had already mentioned those, but trying to understand how those who are working with parents, who's that first access point with parents, what are their most commonly used resources? I feel like that's our goal when we get these individuals together and then learning from one another. So Candy, I'm going to use you as an example. You're working with parents and you use a very common resource, but you hadn't heard of one from that somebody else that came and shared. And that's still in line with what we feel like is valuable information for us. Are we missing something?
Didn't we also talk about those like boots on the ground, not necessarily just like first responders, but the people that have like that direct client care contact, making sure we got them around our table to understand what resources they have or don't have? I'm not sure we did anything else with like next steps on that. Denise did that big list on the board about who do we think we need here, most important community members, and then we got it down to like 8 organizations that maybe hadn't been invited.
I think those are the people that we're talking about.
Right.
That were invited to this meeting.
Does anybody have that list handy?
Yeah.
I sure don't.
I think summer's hard.
Oh, I totally agree.
To bring new people to the table.
Yeah.
So that could be a roadblock right now.
One point I have on the table a few places, we were gonna go to like where they were at and ask them questions. And so I know that we have some of that data gathered too from youth, and then I know we have some from the migrant parent. This is hang on a second. This is the groups that we identified back in April. Try to make that a little bit bigger. I know we haven't been able to I know Jamie Legates has been having some hiccups, and I do think, yeah, part of it is just seasonal, end of school year, then into summer. I don't know if we would have more success in September, October, something like that. I think that that's worthwhile, but I don't think that we're very far off track from what we wanted. Like, I think that we're getting the information that we want. It's just how to start organizing their asks and their requests and their responses. When we talk about a parent engagement center, are we talking about a physical location or are we talking about a virtual location? I think that that's something that I've been also trying to wrap my head around, and I'm not quite there. Not virtual, yeah.
That's my vote, but I see that more as a physical location, or then it could be connecting other parents with maybe the same parents that are in their child's school. Like, just making those connections, for helping them make those connections.
I'm just laughing. Your village.
Yes, yes, we need a village.
And I think there's that avenue, definitely. However, so Kearney Public Schools is also working with a couple of groups to provide, like Buffalo County Community Partners resource list is going to linked, if it's not already, but it's going to be linked like where it's front and center, along with another organization, and I can't think of the name of it right now, but it's an emblem that's going to be on our school website. And so if a parent is, my child's not making curfew, or ever, my child talks back, my child started drinking, my child is having mental health, they're self-harming, I don't have a village in Kearney and I need help now, they can then go to this area and get immediate access to some coaching and some ideas, as well as potential local resources that can eventually be of support and help to them. The nature of this position, I'm just on a lot of boards right now, and there are a lot of boards trying to do this exact same thing. United Way, Buffalo County Community Partners, Friends Mentoring, I mean, all of these, which I think is awesome and I think it's great, but I also think maybe we need to come together. Maybe we need to come together as community organizations and put our funding together, put our heads together, and put our efforts together to all do what our goal and vision and mission is, which is to help support our parents, to take care of themselves, to then be able to parent their kids. Because that really is at the heart of a lot of, we're seeing student issues at school. So many times when you're talking with the school counselors, school social workers, parents are saying, I don't know what to do. I don't know what to do. I don't know where to go. And so that is becoming a really big buzz, not just at the school, everywhere. The doctor, I don't know what to do. I don't know how to do it. And so I don't know exactly who the people at the table need to be, I guess, but just know from a 30,000 foot view, who's on a lot of boards, there are a lot of organizations and a lot of groups that are trying to accomplish the same task. And so I don't know how we get that to come together. We need to work with each other and not against each other.
I was also reading some of the responses from the youth. We're busy. We're busy. We're busy.
Mhm.
As parents.
We're busy.
Sarah, I've noticed that to connect. And not connect through this.
I appreciate what you're saying. I think that may be some of the reasons why we don't have some of those organizations represented, is because
they're doing the same
they feel
work.
it, right? And so can we brainstorm a little bit about how do we bring those, when you think about the boards that you're on and you think about the message, are there some common people or common links where we start a conversation to say, hey, I'm seeing repetition?
Yep. And I've already thrown out, well, we've been partners, this kind of started doing the same thing. Maybe we should So there's, I mean, I've planted a lot of seeds in a lot of these different places, including the school, as well. So just, yeah.
And that is a common theme, even with online resource directories. Whenever you get new monies, everyone wants to create one, and there's 1,000 out there, but you don't have the sustainability to keep it current.
Right, it's that emergency, right? It's that I'm in a crisis and I need help now. And I don't have that, village. But then the cool thing about some of the online resources that we're getting connected with at the school is that is a huge piece of what they do, is that they then work to connect the families with a local resource for sustainability, for long-term.
Crisis, they need somebody to be a voice of reason.
Yes.
Like just to be like, okay, take a deep breath. Let's talk this through before you get too far into this crisis. It always have to be a crisis.
Has anybody had any experience with the hotlines, like the child family hotline? Boys Town has a hotline. I've already had families that I've referred to that just because they needed somebody to talk to.
We, in conjunction with Boys Town, started a school resource support specialist at Horizon last year. That will continue again this next year. Then I added another component to that with juvenile justice grant money and community-based grants to actually add a position at Sunrise. It wasn't totally funded, but it's going to have somebody this month to kind of that's going to work. Working with at-risk youth at your eyes. Crime Commission's always said you can only go from like 11 to 18. We will start working with kids younger than 11. It's more preventative. One of the things that we've talked about, and I've heard talk about for almost 30 years, is doing the crisis management, but it's at that point, it's almost too late. I work with a lot of 15 and 16-year-olds that they would like me to change, parents would like me to change the behavior in 2 to 3 months, and they've learned it for 16 years. It ain't gonna happen. And we're fortunate, knock on wood, we haven't had any overdoses in high school kids, but I'm pessimistic, I don't know, whatever term, but these kids who are getting THC and some of their vape stuff, and I know the people who are making them and putting them together aren't chemists. So eventually something's going to happen, unfortunately, but we're trying to do stuff through the county attorney's office and working with Boys Town. We work with Compass, doing some family support. It's all got to be pre-adjudication before they actually are filed on in court. So we're working with about 1,000 youth a year between our truancy, we do victim stuff with central mediation. Out of the $250,000 in grant funds that I've secured for this next year, almost 150 of that, 150,000 goes to community agencies and resources. So it's not kept within the county attorney's office. That's put out for all these different programs. So we're always looking for suggestions and ideas on how we can help kids. It's got to usually be between 11 and 18, but if there's a family member that's middle school or elementary school and they have one other kid that's in that 11 to 18, they can be helped. So that's one of the things when you mentioned Boys Town, it made me think of that, but they're a great resource. So is Compass. I think I've got almost 12 different agencies that get funding from us, and the health partners kind of do our overall meetings like this that kind of help give me ideas on things to go for with grants. And the school's been very supportive of that. Truancy has always been an issue in the 20 years I've worked at the county attorney's office. I think I learned that within 3 months of being there, that truancy was our #1 issue. COVID accelerated that. Zoom education failed miserably. When 90% of your kids fail doing in-home stuff, I think there's some learned repercussions from that they don't think they have to go to school anymore. We've got to really turn that the other way around. And I don't know, I'm still thinking of how things we can do with the school, social workers, with the counselors. Just sending a referral to our truancy officer doesn't cut it when you go to court. You got to show what services you've attempted or tried. That's the way the statute reads. So I don't know, we're always open for suggestions. Sean Etherton, the county attorney, is pretty proactive when it comes to getting help for families. What, try to work closely with APD, and they do an excellent job of getting kids to us, that we can actually try to help before they get into the system where they're filed.
Doug, for sharing that. I can't remember what meeting it was, go figure, but Megan Andrews had shared that a story from the program that they're doing at, is it Horizon or Sunrise? I'm sorry. Horizon. And it was exactly what like Erin has been sharing these last few meetings about that village. It was someone that mom could talk to, and someone that the child had that was trusted, that wasn't there to judge or reprimand, but was really there when they were facing issues. And that kiddo was coming to school instead of staying home because something was going on, over the weekend at home, instead of staying home and being truant. They were coming to school so they could talk to that advocate, and I don't remember exactly what that was called. So it was a pretty cool story. So I'd like to remind me to have Megan Andrews, if we can, to get her to one of these meetings. But I want to come back to kind of what you were mentioning about the other, and I heard United Way, Friends, KPS, and we all work together. So I think we realize that these are all things that have some common threads. But does everyone agree that maybe we should start looking at how these overarching agencies can come together to talk through what is that common goal and that common thread? I'm not saying we have to scrap this agenda, but since we are looking at what I heard potentially was waiting until September when things slow down in the summer to start inviting newer members, that maybe we can come together as those agencies and start talking, like, what is your goal? And start learning from each other that way, instead of recreating and reinventing.
Well, and a lot of the agencies, like for example, that United Way is working with, are agencies that are in the thick of this, and they're getting that feedback. They have to have that feedback in order to provide to United Way to show that the funding is being used appropriately to support families, to support youth, adolescents, et cetera, et cetera. And so a lot of the information that we're wanting to collect and that we're wanting to get, it's already being done. It's just, it's being done in a different, like, this is what my family needs. This is what's great about Kearney, and this is what's not, these are the services that were easy to get a hold of, and these are the services that were hell to find. So I just think if we could maybe work smarter, not harder, beg, borrow, and steal some of the efforts of all of these other organizations that are needing the exact same information, just streamline things and make a bigger impact.
It sounds like we're saying it makes sense to not reach further into families, or even that we want to focus on what are those collective organizations and have maybe a high level and focus plan that would supplement and enhance what we're doing. How do we get those organization names and people names? Sarah, I mean, you've listed some, are there others that are in this meeting that you're feeling the same way, and you're engaged in some other boards, and could we just all email? How do we get started with that?
Right. Yeah. Yeah, I think once United Way gets through the Freedom Fest, then, they work with 20 partner agencies that, that they're getting those, I think every 3 months they're getting check-ins with, and so on and so forth. So, they don't necessarily dictate what the agencies are doing, but obviously they fund organizations that are meeting the criteria of the United Way vision and mission, which is to help families and youth in our community through to be successful, right? Which is what we all want to do. So they would have some good perspective on organizations that we could potentially work with or get information from.
So would this meeting be a good platform, or do you think it's a smaller? I'm just trying to figure out, do we invite everyone here? Try to figure out, the thing that comes up to me is your goals and what you're currently working on.
Sure.
to get a better understanding, but there's probably some better questions and
Right,
things
right.
we want to understand.
Yeah. I don't know, on that. United Way also meets at noon. So there's that piece, but they have, gosh, over 20 members, as do we, so it could get really ginormous. So it could just be maybe some representatives of each that could just, be able to voice what's happening and, visions and goals and so on and so forth.
Thoughts from others.
I have one thought. I don't know, I'm not the techie person to ask, but podcasts. We can't get families or providers together. Can like maybe a group of the people that Sarah was talking about, maybe put together podcasts that maybe even providers could listen to during nap time.
That's a fun out of the box idea. I love it.
It's different than Talk of the Town, but you could.
Well, even like a video series where you could have a playlist of different.
You could have different topics. Maybe
And it's accessible on their own time. It would be probably a pain to keep it current, but if you have the video there and we could disseminate it.
I'm trying to learn how to golf.
Well, it's nice with YouTube is a lot of that will auto-populate your captions.
I'm like worse than my kids right now. I'm like, golf swings.
Ellery needs a podcast.
Put a screen in front of
What I was just thinking about was that, we had prevention discussions with asking the youth advisory board. And some youth advisory board students who have graduated a probation or diversion program and asking them like, what would have helped you or what would get you, and what would have kept you from starting drinking or vaping or whatever. And one of the big things that we kept hearing was, I wish my parents knew where to get me help sooner. They really, I think that a lot of them have liked even the out-of-state placements too. Like I know we have youth going to Utah, and they've really liked the programs for drinking and addiction there. But that was one of the things that we heard over and over again in our prevention discussions was, I wish my parents knew about where to get me help sooner. So, and I wonder if, and that was part of it too, was they were like, and it's not just my parents, but if I know where to get the information and if it's accessible to me as a youth, then I can tell, where they say on here, we do suicide prevention. We keep our classmates safe. That's what we see our role as. And I was like, it shouldn't be your role. And they were like, well, but it is, because we often know a lot more often, and especially if their parents are Spanish speaking only, we know where the resources are before they would. So I like the idea of something like that, making it really accessible. I think that United Way has a really cool platform with that and but I just, for youth specifically, it's kind of, that's a little bit more challenging for them to access through there. And I'm excited about KPS having, and the Stephen Group working to get those resources onto every school website. I think that's going to be really good too. I wonder if there was
211 as well as a resource, and anybody can access that. You don't have to be like of age. So they're looking for resource, that's somewhere else. Could
Can I
go.
ask a question as far as that? Does that need to be more of a prevention piece earlier on versus my parents didn't know where to send me because I was addicted to this?
I think it could be both. I think that definitely students are asking like, yeah, my parent, I know my best friend is addicted to such and such. His parents don't know where to send him. But I also, some of our younger, like middle school responses were more like, I know that my friends are starting to get interested in this. I don't know how to talk to them about that.
Yeah, and I don't know about what the wait time is now for somebody to get a drug and alcohol evaluation. For a while, it was 6 months. And I mean, if you're addicted, you're not gonna wait. So I know for our, at least in the diversion stuff, we've kind of bypassed doing an initial since it's their first event, but we give them the resources and know that these are places in the community for counseling and all that, but for full evaluation, which last I knew, they were probably close to $300, which is also a financial hardship for families if they don't have insurance or the deductibles are higher, so.
Hey, I'm gonna bring us back again. I think I am trying to figure out what is best for this group to move forward. So, one, I heard tabling this discussion with parent engagement partners until at least September. Also heard that we really need to come together with the other groups that are working on very similar goals or at least similar outcomes serving youth and families. I heard United Way, I heard Friends, and I heard KPS. Is there anyone else before we move forward? There is, if you think of somebody when you're driving home, let us know.
Arc of Buffalo County. I know we're working with the Kids and Dreams Foundation to provide a parent support group for folks with autism or experiencing disabilities. And often that can be a group that gets missed in these discussions. So making sure they're at the table will be good.
There are a lot of groups that are doing this work. I can't list them all off right now because there's just a lot.
So in my thought process, I haven't looked at July or August. But it's potential that we could maybe skip July's meeting and have this conversation in August, which would give us all of July to get these people together. I think it's just email introductions, letting them know that we think that we're working on similar goals and getting them to the table. And really having a conversation on understanding what it is they're working on and how we can partner together.
I was hearing what you were hearing and everything aligns. The only other thing I noted is just thinking about those groups that actually host parent groups, like Families Care has a parent group. I came across Kearney Community Moms through New Life Assembly. So I think groups that are actively hosting parents, to have them in those conversations so that we can get some feedback.
To still have them at the table when
Yes.
we're having that conversation.
It'll be good to have connections for the parent network that they work with, but I think their voice at the table will help structure some of what the other agencies are doing. And then I wondered about Safe Center. You guys have connections with families through your support groups, so I don't know if that would be a good place. And then the migrant education parent group were the ones that I thought of.
Other thoughts, questions, or comments? All right, kind of back to the drawing board one more time. But I know that the work that you guys do is amazing and you are already serving youth and families and you're working with all of these partners. It's really just trying to get it streamlined and it's challenging. But we appreciate you guys coming to the table and working through it with us. We don't have the answers. We're not the experts. So we look for your guys' guidance and we look for our lived experience guidance and hopefully we can kind of continue to work through that and find some positive outcomes. All right, we have 15 minutes left and I think just a few short updates. Is everyone in agreement then that we are not having a July meeting and we will come back into August? And I don't have the date pulled up. Yes. Okay. Emily says yes, so it's got to be a yes for everyone.
There probably aren't many people that are going to fight to have another meeting on that. In July.
I think it would be August 16th, no?
The 23rd. And we will be back at the Hunter Center in August. So August 23rd. 12:30 to 1:30. We will work, and Sarah, I'll probably have you CC'd on any of those emails, working through some of those members. Just real quickly, the really only other thing that is on the agenda actually is that 1173 project. One, thank you all for sharing the word, for attending those sessions. we were personally thanked for having such a robust community, having like a diverse attendance, you know, different community members, voices and things that were shared. So kudos to all of you because you're the ones that made that happen. There are pieces on the Reimagine Wellbeing website, and it's just reimaginewellbeing.ne.gov. You can go and see the mission, vision, and goals. You can see the notes that they reported back from those conversations in May. You can see it from other community members. And then I just wanted to share that you can still create or provide input and updates. There's a website there. You just type it in and it goes directly to the Stevens group. So you can still get your voice heard if there are other things that you wanted to share that you didn't share. They have a few more community meetings, North Platte, Lincoln, and Scotts Bluff over the next few months. It looks like they're taking July off, but August, September, October. And then they are presenting to the legislative committee in November, and in December, they are supposed to have their first draft of their framework. So if there are things that you did not share with the Stevens group or things that keep coming up, be sure to get on that website and type them in there because they are compiling all that information. And by December, they should have their first draft of what this Reimagine Wellbeing looks like. So that is all I have on that update. I think the only other thing to mention is that the resource sharing table is up here in front of Alex, that there's some resources up there that you haven't checked out, please do so. Reminder each meeting, just bring any resources that you want shared out with this group. Actually, Ellery and Alex, was there something else that you wanted to share on that?
Just that we're going to be moving the resource sharing to the end of the meeting, since that was taking up a lot of time at the beginning of meetings, and hopefully then we'll get, if people need to take off early or something. So that's it.
I feel like I just took your part of the agenda, which is next.
Shoot, I
steps.
don't
Do you
care.
want
I
to go
always
ahead?
talk. No, I always talk so much. No.
All right. So it sounds like we've already recapped all of those next steps, and we'll see you in August.
Be good.
Also, if you are interested at all in being a leader, give me an email, we can get you connected with the leadership team.
Is anyone not paid to be here? So we have some stipend forms. Well, fill out a stipend form.
It's picking up. I'm siloed.
Okay, when you're not.
Right, it's like hard to, like, you know, you don't want to be busy because people are mentally well.
Yeah, but then on the other side, it's like,
Excited when I'm busy and then I feel bad because,
no,
yay,
no, I know.
we're struggling.
What?
You know, exactly, and that's really what. Right. That I've worked myself out of a job, for sure.
You know what I mean?
Know what you mean?
And so anyway, it's just really interesting. And so
Well, it's just last year, the bar there, and then by the gas station, they actually had a post on Facebook saying that they needed help out in the yard. It's like, did they post that again?
They're gonna get a survey and we're gonna
pretty
look
much involved about that. A lot of Savannah would obviously.
I mean,
About the,
Savannah just started, right?
yeah, she's been there 8 months, 9 months.
Yeah, I'm